Good, how are you?
Good, thank you. I'm going to start by providing us with some privacy and comfort. I'm going to do some hand hygiene. And I'm just going to start by looking at your ID band. And can you confirm with me your name and date of birth?
Grace Maloof, 11/10/2001.
Great. Okay, so I'm just going to ask you a few questions. Can you tell me where we are today?
Yeah, we're at the clinic
Yes. And why are we here?
to do your assessment.
Yes. And what month is it?
February.
Great. So patient is ANO times 4. She knows person, place, time, and situation. Do you have any allergies I need to be made aware of?
Nope.
Nope. Okay.
No.
And then, are you having any pain today on a scale from 0 to 10?
0. No pain.
Great. Okay. I'm going to be doing a lung assessment on you today. It is going to require me to touch you a little bit. Does that sound okay?
Yep.
Great. Okay. So patient has good posture. She has good hygiene. Is well dressed. And are you having any trouble getting around at home?
Nope.
Okay. So no mobility problems to note. So I'm going to get started with my assessment. For this type of assessment, I would normally have the patient have their thoracic area exposed, but for the purpose of this video, I'm going to have her clothed. But I would first want to inspect the symmetry and rise and fall of the patient's thoracic cavity. I want to note any accessory muscles that the patient might be using. With just normal breathing, accessory muscles should not be used, and this would be an abnormal finding and one that I would want to document. But I am not noticing any of that. There is symmetry and everything looks good. So I'm going to begin auscultating the anterior portion of your lungs. There are 8 points that I would auscultate, and I'm just going to have you breathe a new breath with each movement of my stethoscope, and I'm going to move it slowly so that you have enough time to catch your breath. I don't want to put the patient in any distress with this type of assessment. So I'm going to begin. I'm going to start up here at the clavicle. Okay. Breaths were all sounded good. I was not noticing any abnormal findings, and if I did, I would have documented them. I'm now going to listen to the lateral portion of your lungs. So I'm going to start over here on your left side, or your right side, excuse me. And there are 3 lobes on the right side, so I'm going to listen in 3 different spots. Take a deep breath. Again. And one more. Good. Again, I will document abnormal findings. And I'm going to come on the right side, and there are 2 lobes of the lung on the left side, excuse me. So I'm going to listen in 2 different spots. Another breath. Great. Okay. And I'm going to come to the posterior part of the patient's lungs and the back side. There are 10 points where I will listen. And again, the patient's going to breathe a new breath every time. And I'm going to start up here at the apex of the lungs. Okay. Okay. Good. I did not know any abnormal breath sounds, so that is good. So now I am going to assess the thoracic expansion of the lungs. I'm going to place my hands and my thumbs right here at the base, right at the end of where the rib cage is, and I'm going to have the patient take a nice deep breath. Okay, and as you can see, my thumbs expanded up at the same height, and we're both symmetrical, which means that both lungs are filling adequately and at the same rate, which would be a good thing to know. And then finally, I'm going to do a costovertebral assessment or angle tenderness assessment on the patient. So I'm going to come down here where the kidneys are. Any tenderness? No. Okay, and on this side? Any tenderness? No. Okay, good. I'm going to document my findings, and this is the end of my assessment.